Good afternoon, ladies and gentlemen of Cedarfield. Hope all is well with you on this fine December 6th at 2 o'clock. This is our navigation chat, our fifth one of five actually for 2021. We're going to talk a little bit today about what is skilled care, otherwise known as Medicare Part A. This is really critical to our safety net, our continuum of care, and we want to clarify what is that level of service, when is it coming, and how are we going to get here. For those of you that don't know, this is Matt Dameron. Matt Dameron is our Associate Executive Director, and we're going to talk probably for, I think we have about 30 minutes worth of content. If anyone has any questions after we have this navigation chat, and or people are reviewing this chat from Touchtown in the next couple days and wish some clarification, please feel free to reach out to Matt or I, and we will help you with any and all questions. So welcome, we're glad you're here. First, we're going to just kick off things and just talk a little bit about what is a skilled nursing community facility. What is, can you help Matt?
Hopefully.
Clarify that?
Hopefully. You'll hear the word SNF a lot, which is a horrible kind of institutional type thing that you hear just in our profession in general. But SNF, it's SNF, and it actually stands for a skilled nursing facility. And we try not to use that dirty F word around here and say community, but it's a skilled nursing facility. So that kind of differs from the service that we provide here. And I can go into just a little bit of the difference between what a skilled nursing facility is compared to what we have, which is long-term care. So long-term care, which is what we've had for 25 years now, really focuses on the what it says, exactly what it is in the name, that long-term care of a resident. So a resident that needs physical assistance with many of their activities of daily living. So that could be anything from medication management to bathing, to dressing, to eating. It's kind of helping those residents for the long term. And in many instances, it could be for the rest of their life. A skilled nursing facility really focuses on the rehab aspect of things. So it's typically, not always, but the vast majority of the time, it is someone that has had a change of condition. So they've had a surgery or an injury, and they need to go to a place to receive rehab therapy, get better, and hopefully go back home. And so they're really kind of two different buckets, kind of the long-term care and then that short-term rehab to really help someone recover and get back home.
Yeah, that's great. And so when we think of the services that are provided within a skilled setting or a covered Medicare Part A stay,
right,
interchangeable language, what are some of the services that are covered within that stay?
Right. So so the other difference, which I didn't mention, is that that long-term care is private pay, whereas skilled stay, a skilled nursing facility stay, is covered by Medicare Part A. So and they cover quite a few services. I have them listed here. And that is their apartment, the room that they're staying in, their meals, the actual care that they receive from the nursing team members, physical therapy, Occupational therapy and speech therapy are all covered. Social services are included in that. All of the medications, medical supplies and equipment used at the community itself, ambulance transportation if that's necessary, and then also dietary counseling. So having that dietitian consultation with the resident. So all of that is covered by Medicare Part A during your skilled nursing stay.
Okay.
It's quite a list of things.
It is. So why? So Cedar Field's been here since 1996, and we at this point we don't have this service.
Correct.
So why doesn't Cedar Field have this Medicare Part A inpatient setting at this point?
So it kind of goes back to our history, and one of our leaders many years ago just really didn't want that federal oversight of our communities, and so it has just been our practice since really before Cedar Field to not have that. And actually, the other communities, the other Hermitage communities, Roanoke and Northern Virginia and Hermitage Richmond, are not certified either, and have always been private pay. So it's been in our history for a little while.
Okay. So why now? Why
Yeah.
why are we embarking on this new service line for the residents?
Right. That's a very common question. I explain why we haven't done it, and it's immediately followed with, then why the heck are we doing it now?
Right.
So this is actually part of Cedar Field's master plan expansion that started many years ago, before both you and I were here, when residents and team members and family members were together kind of dreaming up the future of Cedar Field, and which has led to expansions like the Pathways to Wellness building, the new neighborhood or the household building, D-Wing, but then also some of the service lines that we have in place now too. So one of the things that was missing at that time and is still missing, and that the residents really wanted was that skilled nursing care that other places, the vast majority of other long-term care communities have, and that we just haven't had. So this is just that next stepping stone on the path of that expansion and future planning for Cedar Field.
Right. So continue to project forward a little bit. So Cedar Field's we've been planning for this Medicare Part A neighborhood for some time now. What's the projected date of when we'll have our neighborhood up and running?
Right. So that really is kind of hinging on our construction, and what used to be Lavender Lane, that area, those residents have now moved over to the new household building permanently, and here in the near future, that their old space, which we called Lavender Lane or Healthcare North, will go under construction. And once that construction is done, during that time, we're kind of working behind the scenes to get all of the prep work done, so that we can, when that area opens, we can jump right into it and take our first skilled resident.
Oh, great!
Yeah,
that's great. So how about we talk? The other frequently asked question has to do with the payment structure. What is this going to cost if I'm a resident and I'm here at Cedar Field and I happen to go into this Medicare Part A neighborhood? Is it going to cost me any more money? Right.
That is a big question, and one that I would be asking too. It does not. There are stipulations that come along with federal funding, and Medicare is in this instance is no different. So there is certain time periods. So from day 1 until day 20, the resident pays nothing, absolutely nothing for those services that I just laid out a few minutes ago. It is 100% covered by Medicare. If you have to, and the majority of people are leaving during that time frame. They're coming in for a short stay. Go ahead.
That's a good point.
Yeah.
The national average today in a Medicare inpatient community is about 18 and a half days is the average right now.
Right. Because you're getting that intensive rehab, that intensive care to get you on your feet as quickly as possible. So from days 1 to day 20, there is no charge to the resident. And then from days 21 through day 100, if you need that, it is kind of a copay per day, which is in 2021, it is $185 a day. Again, that's only from day 21 through day 100. And then after that, day 101 and beyond, then all costs are passed on to the resident. But again, this is really focusing on that short-term rehab stay. So you have a sudden illness or a sudden a hip issue or a knee issue, something along those lines, and you're really working hard to recover and get back home. So
usually 7 days a week.
Correct, 7 days a week. So not a lot of people stretch out to those later tiers.
Yeah. Medicare refers to this as an episode or a benefit period, and so usually a benefit period if the therapy team and the interdisciplinary team, when they're communicating with Medicare, can prove that a resident needs this funding through the 100 days, then Medicare will provide that funding, and then anything over the 100 days is passed on.
Right.
Okay, so we talked a little bit about the difference between a nursing home, long-term care, and a skilled nursing facility. How about a little question that usually residents ask about the regulation? What's the difference between? We just mentioned that we didn't want federal oversight for so many years, so now we have a frequently asked question about what's the difference between the regulations in what we currently have, which is a long-term care setting, compared to a Medicare Part A setting?
Right. Very good question. So, like I mentioned before, they are two very distinctive categories: that long-term care and that skilled community. So they are governed different ways. So we are currently held to, as a nursing facility, we are currently held to state guidelines outlined by the Virginia Department of Health, the Office on Long-Term Care within the Virginia Department of Health. So they have what we kind of refer to as a little book of regulations, and those really focus on basically they conduct state surveys to make sure that there are no violations of those regulations, of course, and there's no immediate threats to resident safety or security, and to make sure that the residents are satisfied. So it's really kind of like the basic, are our residents being taken care of? Are you meeting these standards? And are the residents happy with that? CMS, Centers for Medicaid and Medicare Services, they actually take it to another level. they not only evaluate resident safety and satisfaction, but they also really look at quality measures for both short and long-term stays. So they govern by we call it the Big Red Book, which is literally a big red book of of regulations. Anytime you involve the federal government, there's going to be quite a few regulations to go with, especially with them reimbursing us in the process. So it's really quality measures on top of those other things to make sure that communities are held accountable and up to a certain standard. You'll hear star ratings for different communities, and there are certain quality measures that the government is looking for in order to issue these star ratings, whether it's resident satisfaction or nursing staffing, ratio of registered nurses to licensed practical nurses, things of that nature. So it's just a more comprehensive survey where they're looking at a lot of different options, not just the basic needs of the residents.
Mm-hmm. And so, can you help residents and team members that are viewing the mock survey?
Mm-hmm.
We just facilitated a mock survey in our healthcare area a couple of weeks ago.
Mm-hmm.
Can you help people understand what that survey was about, and how does that survey relate to this time next year?
Definitely. So we have contracted with an outside company that's been around, the Mary Childs Group. They've been around for decades now, and they really help communities go through this certification process. And not too long ago, we underwent a mock survey in our health services area. And the purpose of that was to not only help us improve the services that we already provide and the systems that we already have in place, but to also point out the systems and the processes, policies, procedures, staffing, and so on that we will need to put in place in order to become certified and have that federal stamp of approval. So they did a tremendous job of outlining
They really did.
The items that we need to work on right now, but then also the systems that we need to put in place over the next 6 to 8 months to get us ready for that survey. So not only were they helping point them out, but they're also going to help us put them in place as well. And so having that expertise at the table is amazing for us.
That's great.
Yeah.
So one of the other advantages of having a Medicare certification is that the federal regs, and if you want to, Matt just referenced one of the measurements in this area has to do with a star rating that CMS has developed in order to be a 5-star, which Cedarfield will attain, community. You have to hire and staff this Medicare neighborhood with a different level of professional. So can you talk a little bit about the advantages of that for the residents?
Definitely. There are different requirements, as Michael mentioned, for a skilled community, and one of those is the requirement for registered nurses. So right now, our licensed practical nurses, our LPNs, greatly outnumber our registered nurses. But in order to obtain that kind of 5-star staffing ratio or staffing standard, you kind of have to have this 80-20 standard, this 80-20 rule, where 80% of your nurses are registered nurses. So they have received that extra training, that extra schooling, as opposed to 20% with the licensed practical nurses. So what we're doing is quite a bit behind the scenes over time to help us prepare for that and to prepare for that change. So that's why we are attempting to hire more registered nurses as opposed to LPNs. We still love our LPNs and don't want them to go anywhere, but
No, we don't.
But as we do have some turnover, we're looking at those registered nurses
in that neighborhood.
In that neighborhood, because they will have that expertise. So one of our clinical leaders that we hired last year, who will be in this skilled neighborhood, is a registered nurse. And then we also were looking for an MDS coordinator, a minimum data set coordinator, which really helps with the layman's terms, kind of the paperwork side of things, keeping track of resident needs for reimbursement. That person is also a registered nurse with 17 years of experience in a skilled setting.
And she's here already. Her name is Susan Dunaway.
Dunaway.
She's been with us for a couple of years now.
Yeah, about a year or so now. And of course, Tamika, our director of nursing, has a tremendous amount of skilled nursing experience, which is another one of the reasons that we wanted her with us, to kind of lend that experience. And even a couple of our other clinical leaders that we've hired recently, they're LPNs, but they also have quite a bit of experience in that skilled setting. So we're looking at kind of changing that ratio to really give that expertise and lend it well to all of our residents.
Great. Mm-hmm. We have a couple more minutes.
Okay.
There's some additional items that the resident should know about this particular area that would benefit the resident who would
Mm-hmm.
stay in this area. What are some of those other services that we do behind the scenes to make sure that they're getting the great care while they would be having a stay in that setting?
Right. Like Michael said, the kind of the behind the scene things that we're doing and that we've put in place over the last about year and a half or so to get us prepared for that is reviewing our policies and procedures to ensure that they are meeting that big red book of standards, so that we will have an easier transition kind of paperwork wise when it comes to making that transition to certification. We also do quite a few we love our meetings around here, but they're really necessary for tracking the type of care that we're doing and what we're going to do moving forward. So we have daily clinical meetings where our nursing team gets together and discusses the last 24 hours, any resident change of condition or just changes in general with that resident, or any incidents that have happened. And we're really looking at specific things that are required for us to track under federal regulations, which are falls, different types of medication, especially narcotic usage. We have to track that heavily. We also have to track antibiotics heavily. It's an antibiotic stewardship program that you have to put in place to make sure that we're not using those unnecessarily. And we're also doing quite a few more assessments now to ensure that we're trending those different items to make sure that the residents are receiving the best care possible. So that kind of rolls up into weekly, we call them standards of care meetings, where we discuss the last week. Our medical director, co-medical director, Dr. Amy Shear, is in that meeting with us every Tuesday to make sure that we have her stamp of approval and her oversight on all of the items that have happened over the last week. And then all of that, those weekly meetings kind of roll up to our monthly core meetings. It's a clinical operation report, and essentially what we're doing is tracking and trending what has happened in the last month and what we can do to improve. It's kind of a constant quality assurance improvement plan. If we've had quite a few falls in a certain area, well, what are we doing to improve that? What systems are we putting in place to reduce that as much as possible? And that's just one example. So monthly, we meet with our consultant group to go over those items, and then quarterly, we call it QAPI, which is Quality Assurance and Preparedness, and it really focuses even more so on over the last quarter, what has happened, what can we do to improve and move Cedarfield into the future. And actually, both of our co-medical directors, Amy Shear and Dr. Varanian, are there with us, as well as our pharmacy consultants from Remedy, and it's just an extra little layer to make sure that we're doing the right thing and we're putting the right systems in place to constantly try to improve the service that we're providing.
That's great. Thank you, Matt. So just a little recap here, since we have a couple minutes. This service line is due to come online, borrowing no construction overlays or time extensions, probably about this time next year. We have we've had a plan here in the last 3 years to start prepping for this 20 apartment neighborhood, and we are about halfway through that plan, getting prepared for Medicare licensure and for the inspectors to come out and making sure that we comply with the federal regulations, which are different than the local regulations that we have to abide by. So,
right.
Matt is a nursing home administrator through the Commonwealth of Virginia. So am I. We actually have one other. Jessica Clark is. She passed her exam 2 years ago, probably about 2 years ago. So you have 3 nursing home administrators here at the community, and we can't wait for this specific service line to come online. It enables us to use our license that much further and to enhance the experience for the resident and to provide another service line for residents to access on a temporary basis. And so we're just really excited about it.
Definitely, without a doubt. It's great.
So this is our last navigation chat for 2021. You are going to see some more energy, communication, and education come out throughout this month, January and February, about 3 other service lines that we have been talking about on this navigation chat. The Wellness Clinic, managed by Ann Hopper, Home Health, the service line of Home Health, and the service line of Outpatient Therapy. And so you're going to see in the next 3 months, in a variety of ways, those service line experts in lots of different locations throughout the community, whether it's a live chat, we call them table talks, having these representatives at different tables at certain times so you could freely go up and ask questions. We're going to have a couple of town hall meetings about these service lines so that residents feel more informed and educated about, again, the safety net that we have been referring to over the last couple of months. So, if anybody has any questions about the content of this navigation chat, please feel free, like I said at the top of the hour, to reach out to Matt Dameron or I, and we will answer any and all of your questions just as soon as we can. Our job is to make sure that the residents are informed and educated. And so no question is a silly question. It's a complicated topic, and we're here to communicate and educate. So, all right.
All right, sounds good.
Thank you for listening today. Thank you for tuning in. Those of you that are watching tonight, thank you for taking time out of your busy holiday schedule. And we'll see you around the community. Thank you.
Thank you.